amino acid, and renin, along with this angiotensin, it forms a system called Renin-Angiotensin System. And again, see this renin is secreted in the juxtaglomerular cells. And the secretion of renin is influenced by 4 factors. First one is decreased arterial BP, then increased sympathetic activity, then decreased load of sodium and chloride in the magna densa, and the fourth one is reduction in the ECF volume. And how this renin influences BP? Here, see, after secreting this renin from the juxtaglomerular cells, it will convert this angiotensinogen to angiotensin 1. Then from angiotensin 1 to 2 by the influence of ACE from the lungs. Then angiotensin 2 to angiotensin 3 with the help of angiotensinogens. From angiotensin 3 to angiotensin 4. What will happen after this? See, it will increase this aldosterone secretion and vasoconstriction. Then what will happen after this angiotensin 4, the release of angiotensin 4? It will regulate this GFR, it increases the BP, it increases water intake, it increases ADH secretion, it increases CRH and ACTH secretion. These are the 5 factors which happens.
The Renin-Angiotensin-Aldosterone System, RAAS, is a hormonal system that controls blood pressure. While baroreflex is a short-term response to sudden changes in blood pressure, RAAS is responsible for long-term regulation. In the kidneys, within the walls of afferent arterioles, there are specialized cells producing prorenin called juxtaglomerular cells. Upon activation by a drop in blood pressure, prorenin is cleaved to form renin, which is released into the blood. Renin converts a plasma protein called angiotensinogen, produced by the liver, into angiotensin 1, a peptide of 10 amino acids. Angiotensin 1 is further converted into angiotensin 2, an 8 amino acid peptide, by the angiotensin converting enzyme, ACE, predominantly present in the lungs and kidneys. Angiotensin 2 is a hormone. It binds to angiotensin 2 receptors in tissues to exert various effects. It stimulates vasoconstriction in systemic arterioles. It promotes sodium reabsorption in proximal convoluted tubules of the kidneys. It induces the release of aldosterone from the adrenal cortex. Aldosterone promotes sodium and water retention in the kidneys. In the central nervous system, angiotensin 2 has several effects. It acts on the hypothalamus to stimulate thirst and encourage water intake. It induces the posterior pituitary to release antidiuretic hormone, which promotes water retention by the kidneys. It reduces the sensitivity of baroreceptor response to increased blood pressure, so that this response would not counteract the effect of RAAS. All these actions lead to an increase in blood volume and blood pressure. Angiotensin 2 is short-lived with a half-life of 1 to 2 minutes. It is degraded into angiotensin 3 and 4, which have lesser effects. Overactive or inappropriately activated RAAS is a cause for hypertension. RAAS is a frequent target of antihypertensive drugs. ACE inhibitors and angiotensin receptor blockers are common treatment for hypertension.